side lying without stones. First of all, draping. Pretty similar to the other draping, tea towel. Yeah. Can you take your hand out? Yeah, good. Female client, you can tuck this underneath the body. Can you tuck this underneath? Yeah, good. And allows you a really nice way to work on the lower back. You see, it's kind of, you can tuck this under, and you have really nice, when you're draping the hand like that, and you have full access to the whole area. Okay, few more things, and you know what, the preparation is quite important here. The pillow. A lot of the therapists, what I see, is that they're putting the pillow according to the table.
No.
So what happens is that the head rolls forward. You need to lift your head. You need to put the pillow according to their position, which is really the line between the ear and the nose, the pillow would go. Some clients are more this way. Some clients, the pillow would be completely turned. So really be sure. The neck should be in continuation with the spine, not too high and not too little. And the knees needs to be flexed and taken up. So then it will be a lot more secure. Yeah, a lot more secure. Anything else?
Pillow between the legs.
Pillow between the legs, teddy bear.
Yeah.
Yeah, or even pillow around the arm. Yeah. Do you have another pillow?
Yeah.
Just for that. So one pillow can go in here, or one pillow can go, and really just having it really nicely and comfortably. Great for pregnant ladies, great for people with low back pain, and great for people with more one-side problem. If they have a hip issue, one side,
Shoulder.
iliotibial band, shoulder, gluteus area, that it does make sense, and it's up to your negotiation. One last thing I want to say is that usually this technique done by physio or osteopath, yeah, and one thing that they have changed is that their table is a lot narrower. So if you have a wider table, it's kind of sometimes hard to access it. So you may need to ask the client to shuffle closer to you. Yeah? If you are in a wider table, it's quite hard for you to reach, and you start feeling your back, technique is not good. Okay. So in this position, you have a lot that you can do quite easy. First of all, mobilization. It's not the shoulder that I mobilize, it's the scapula. Yeah? Do you see the scapula here? I move it a lot. To move the shoulder joint, I will need to do that. I can use it separately, but mostly what I'm interested is that movement. Yeah? Okay. Position-wise is pretty much similar. 3 positions, one from here, one from here, one from the other side. I would actually start from the other side. Yeah? You can do like nice effleurage. Yeah? And one of the techniques I really like is coming from the other side. And I tell you why. Because the hands are just there on the rectus spinae. Now, if you come very close, I want to show you something. I start to call it micro massage. Why? Because the way that you put your hands, the position that you put your hands are quite important on a smaller level. If I would do that, I would have no support. So what I need to look for the support either from their jaw. Do you see that? Now, don't put too much, just a support, or from the other side around the clavicle. So when I look for support, I actually minimize the forces that I need to use. It's not that. It's either this one or that one. Yeah? Now be careful from the ears. So I'm pretty much cupping, and I have contact the neck and the jaw to make it more stable and to make me more relaxed about it. So this is the first technique. The second technique, which is just a modification of it, is adding a little bit of movement to the head. Yeah? And what it does, first I mobilize the spinal joint, yeah, and do that. So it's almost like a seesaw. This hand do the soft tissue, this hand does the movement. And there is no, you can do it side to side, not too much the head backward. Why wouldn't I take the head too much backward?
Too much strain on the axis.
Too much strain on which axis? On extension. You see that if I take the head backward, I can increase the extension. So little, very little. The movement is, actually you do scalp massage, you do a bit of movement and soft tissue for that. This would be especially for cases where the client is quite rigid and you want to say, okay, let's go, hear the groove, get it relaxed, yeah? You can go all the way to the suboccipital, yeah? Good. You can change and then do maybe with the shoulder a little bit. In a way, we talk to the nervous system. And in a way, you want to kind of confuse the nervous system a little bit. To say, okay, get it moving, and let's see how it is. So that's rigidity that they acquired. You have a better chance to go into it, yeah? You can do it slower. Good. So this would be more on the neck. If you're coming to the neck here, wonderful technique is this one and up. Yeah, so the hand is quite loose, and I actually do use the knuckles, but if you look, the fingers are very, very relaxed. Yeah, fingers are very relaxed, and I actually use my finger to acquire their form. I don't do it rigid, otherwise it will be painful for them. Yeah, and then back. Special places, suboccipital area. Suboccipital area to that, to here, all that area that is quite hard to massage when they're lying on the back, yeah, the back of the occipital area. Just think about all this erectospinae muscle, get into here, and the fascia spread really to the occipitofrontalis muscle. Yeah? So you can make the link, for that. Work around the ears, on the back of the ears. Now, so this would be second approach. Remember, the first approach is coming from here, doing the mobilization, then from here. Now, I come to a very, for me, I would say, there is not written law, very important area. And this area is the upper back. The T1, T2, T3 area, C7 actually also. C7 behave like the thoracic vertebra. Now, what is the rationale here? Look what happened in the spine. There is an area that is quite rigid, an area that with a lot of mobility. Now, guess where problem precipitate? On the lower neck and the lower back. Why? Because these are areas that we can move more, so in a way we abuse them. We abuse their movement, yeah? So what you're trying to do here is increase the movement on the few vertebrae below the neck. So you distribute the force, the movement. It's like chain of bicycle. If your chain is not working, they're just rigid, one chain would be more working and would have more problem. You know what, a better example is the paper clip in the office. Yeah? If you take a paper clip and you just move one area, it would break there. If you take anyone has a paper clip here? No, all right. If you have a paper clip, and you know the clip that you take some papers together, if you start moving it in one place, it would break there. So in the spine, this area that we move too much is the neck. So you try to help by actually increase mobility on the other vertebra. Yeah? So in a way what I'm doing, I'm looking at the spine, I'm feeling the spine, I go above it, and then I press down into that direction. If I press down this direction, I just glide on the spine. So I need to create this kind of a bit of motion there. Yeah? Increase the springiness, and you would feel this area is quite tight on a lot of people. So with my thumb I do that. Yeah? However, be careful to go and do it on the neck, because the neck really has enough movement. Yeah? So how do you feel where the neck is? The neck doesn't have very pronounced spinous processes. So I will go around you and let you feel it, and it feels quite different. Yeah? Okay, so coming back, remember this technique? Yeah, of that one and with the movement, and then you're doing this one and coming here, and then for that. Last technique I want to show you is actually the mobilization of the shoulder girdle, yeah? The shoulder girdle, and you can do that. You can do that with a bit of soft tissue, especially not only in a stretch, but also in compression. So when you come in here, you see that I'm actually putting the muscle upward, and in this position, you massage it. If it's too much for you, take your hands and control it this way. You don't have to work hard. You just really achieve the same purpose. And if you want to go down, then have another hand in here. Okay, quite a lot, but I prefer you to do something good and quite good quality. So, any question? So, we did 4 things. Do you remember them? Yeah? Cool. Let's start working. Thank you.